Hello, and welcome to the Brain and Transcranial Photobiomodulation Virtual Summit. I'm your host, Dr. Joe Doduro. My guest today is Dr. Stefano Pallanti. He is the director of the Institute of Neuroscience with many locations. He's coming to us from Italy. He's a member of the I Care for Autism and in New York. It's a huge organization. He's also a member of the Department of Psychiatry and Behavioral Science at Albert Einstein College of Medicine in New York. And I want to thank you. He's going to be speaking to us about autism and autism spectrum disorder. Thank you so much, Dr. Stefano, for helping us out today.
Thank you for having me. It's my pleasure to be here today.
One of the things that we, talk about is, you're a, clinically trained medical doctor. You are also a psychiatrist, and now you're turning your research and some of your clinical attention to photobiomodulation that relates to your neuropsychiatric conditions. Could you kind of explain how you went from something that was very traditional to something that's a little bit more, integrative or something along those lines? How would you tell your story?
Yeah, it was a kind of natural for myself to move from the field of clinical psychiatry, because after I got my medical residency in psychiatry, I started a residency program in neurophysiology, and then I did also a PhD in neurophysiology. So that introduced me to a lot of technology, including the use of EEG and magnetic stimulation, that at the time was mostly an instrument for diagnostic assessment of neurological patients. So before psychiatry started to use it. So for me, it's been a kind of a natural moving like my discipline is moving, because I start my residency program with a board mostly of psychoanalysts, because till the end of the last millennium, most of the schools were run by psychoanalysts. And then maybe you can remember at the end of the 90s, Eric Kandel started to publish a couple of very, very important milestone papers on JAMA about a new scientific framework for psychiatry. And it was the first one to state clearly that we had to move from the interpretation of philosophical of psychodynamic psychopathology and try to integrate the new evidence coming from the neuroscientific finding. So at that point, you put together the evolution of a discipline from psychodynamic culture to neuroscience-based discipline, and the evolution of technology with on the top our low satisfaction about most of the available treatment, and therefore the search for new treatment. And if you combine all this stuff, that it came to me natural to move through first EMS and then in the last 3 years, photobiomodulation.
Were you a bit, you were an MD, PhD, were you a little skeptical that something as, simple as light would have some effect on people's emotions or, psychological processing?
Not so much, because we have, photobiomodulation started mostly in dermatology. So we have effective demonstration of the biological activity of photobiomodulation. And having in mind the concept of mental disorder are not mental, but they are disorder of a connectivity, it was not difficult for me to consider the possibility that any form of energy that can be transmitted to the brain, either magnetic or electrical or photobiomodulation, could have some impact on this delicate system that, you know, it move neurons thanks to very minimal differential potential of electricity. So from one side, if you consider how delicate and how vulnerable is this system, you can imagine that even a very soft energy like the one that is adopted by photobiomodulation can have some impact.
I like the way you describe it. Light helps plants grow and connect. So maybe who knows, the same thing. So let's go to the let's take a look at your research and your slides.
Okay.
Clinical experience with photobiomodulation treatments, a case series of children with autism spectrum disorder. And we're going to include in here a single case of gene SCN2A related autism in a young adult. Proceed.
Okay, thank you very much. This is the title. This is the, let's see what is going on. So it's not advancing. Okay, this is my disclosure. I have a few collaboration, and you see, I'm proud of the last one. We are running a grant NIH sponsored on TMS, on behavioral addiction, that is a field not far away from autism. And this is the outline of today's presentation. The rationale for photobiomodulation in autism spectrum disorders. Then I will show you the results of the study we published a few months ago related to a case series of children with autism spectrum treated with photobiomodulation. And then a case report of a young adult with a specific gene-related autism. And then in the conclusion, I will give a sketch of what we think can be done in the next future and what we are about to do. So autism spectrum, let me introduce you to autism spectrum disorder. It's a neurodevelopmental disorder, early onset. Everybody is aware of a large epidemiological impact of this disorder recently. It was not like that 20 years ago. Now, 20 years ago, it was about the impact was like a case up to 300 children. Now is less than 180. One over 80 children have some sign of autism spectrum disorders. The two core symptom domain are social communication dysfunction and repetitive behavior, according to the DSM-5 revision that was proposed May last year. But I want to consider also the origin of the term autism, because I thought that still, even if it's getting more and more popularity, the term of autism, the term itself comes from a field that now can be really clearly distinguished from the field of neurodevelopmental disorder, because it was the first that used the term autism was Eugen Bleuler, that is the psychiatrist that have given a name of schizophrenia to schizophrenia, because before it was named dementia praecox. And he considered autism as one of the four basic dimensions of a severe psychopathological condition. And the term itself was created like a collapse of autism, that means self-made, and eroticism. So in this term we have together the concept of something that is related to severe form of psychopathology, and also this kind of moral conception of not expansion of a capacity to create bound, but be delimited form of expression of erotism. So I think that is a kind of misleading, because now we know that autism is not always a psychopathology, but we talk about neurodiversity, and we found very mild form with a high level of functioning, and also that the concept of self-pleasure, of erotism, is not really part of his definition. And also it's good now to know that the concept we have is more related to something that involve the imbalance between plasticity and inflammation in a specific age of developmental phase. So the neuroscientific hypothesis for autism therefore is related to a field of neurodiversity that can be a basic condition to create psychopathology, but it's not a psychopathology itself, and involve the model is a complex and involve several factors, including genetic mechanisms that are discovered one by one. I will show you a few of the ones that have been already described. Immune dysregulation, neurofunctional alterations. We don't even talk about autism as a single category, but the definition of autism spectrum refers to a large fund of different phenotypes where this different dimension, genetic, immune dysregulation, neurofunctional alteration, can have a different weight accordingly. So the search after the creation of the spectrum start for the genetic fingerprint of each of these conditions. Several of them has been already distinguished. And what is interesting that meanwhile the research is finding the genetic fingerprint, each of these single form, let's say the Rett syndrome, has been considered to be moved to the field of neurology. But the truth is that this is a misunderstanding, because this is not moving this condition from the field of psychopathology or psychiatry or behavioral observation, that is still very important, but it's just giving them a more precise definition, a more precise line, and a more precise characterization according to a neuroscientific approach to the study of neuromental disorders. So I told you that inflammation has been found in brain and plasma, increase of inflammatory cytokine, decrease of anti-inflammatory cytokine has been reported in several subsamples, but of course it's difficult to find an homogeneous description of inflammatory panel in this population, because it's not a single category, but each of them have different expression in terms of plasticity as much in terms of inflammation. And the general characteristic of ultra-functional structural brain mechanism in autism is mostly related to increase of the activity of the so-called default mode network, that is a part of a connectivity that work freely without focusing on specific thinking or task, and is that one that is working when we are looking to the screen of a TV without even thinking what we are looking. And so the brain is like a kind of enjoying this kind of activity, but it's disturbing when you have to focus on something, and so have to be counterbalanced by focus attention network. In autism, there is a prevalence of a default network mode that interfere with attentional activity and focus activity. And this is related to this imbalance between inflammation and process of plasticity. I'm used to say that the plasticity of the brain is like really a garden and a flowering of a garden, and the immune activity is like the gardener. It's that one that have to give to shape the form of a connection. And when everything is going well, of course, the final results is a nice garden, but in this case, can be kind of forest difficult to be explained. Therefore, considering that photobiomodulation has been shown as transmitting energy by cytochrome C and reducing some of the inflammatory process, and meanwhile having good effect on the plasticity, photobiomodulation in a disorder where the imbalance plasticity inflammation is a core hypothesis can be a good candidate, especially if you consider that we don't have any pharmacological treatment for core dimension of autism. The most effective treatment for autism still is a behavioral intervention, ABA intervention. But in terms of biological intervention, we are still searching for something more effective. So at the start of this research, of course, we consider the results from animal model. A model of autism can be produced with the inoculation of valproic acid in mice, and that because valproic acid increases the inflammation in the hippocampus, alter the activity of macroglia and the reaction of the astrocyte, producing behavioral, a reduction of social interaction, and a reduction motor coordination, cognitive function, and established bonding with other members of the same group. And so it's interesting because in this model of autism, photobiomodulation have been shown to increase spontaneous alternation compared to the group without treatment with photobiomodulation, and also reduce the impairment in repetitive behavior. Giving a new free opportunity to movement to this population. And in terms of biological activation, it's interesting to see that also there is a reduction of the activity, inflammatory activity of macroglia, and with a decrease with the 83 MN laser group compared to valproate. So apparently, a reduction of inflammatory activity of the macroglia is coupled at behavioral level with an attenuation of a repetitive behavior and improvement in social communication. So it was the only study on animal model. And then more recently, in 2018, a group of scientists, part from Israel and part from Cuba, have collected a sample of young population autism, children, adolescents in the age of 5 to 16 years, received 8 5-minute laser light. In this case, it's not a photobiomodulation, it's a laser, but with a different pulse, 635, and a power of 5 microvolts. And it's interesting because even in this sample, the treatment significantly reduced aberrant behavioral checklist total score. That is an index very well known, assessing the dysfunction of behavior in autistic spectrum disorder in severe adolescent. Also, a good improvement in the clinical global impression scale, as you can see in this two graphic, while placebo doesn't have any effect on the same population. So that was kind of encouraging. Before we we start to use it, photobiomodulation, in our institute in Florence, where we also treat with photobiomodulation several other categories of patients, traumatic brain injury, or even post-stroke, or mild cognitive impairment, and other form of neurodegenerative disorders or difficult to treat patient with depression. And so we enroll in a collaboration with Albert Einstein and Fatto Bene Fratelli Sacco in Italy, Milan. We enroll, this was the first study with a LED photobiomodulation instead of a laser. And you see there are differences between laser that is more pointed and instead let a more large area of tissue irradiated. And the study included 21 patients, 13 males and 8 females, with a range of 5-15 years. And you see the comorbidity, the medication, that in this case were mostly like probiotic or omega-3, melatonin, so not really psychodrug in this sample, because especially first of all, there are not indication for use of psychopharmaco treatment in autism, apart from irritability or other aberrant behavior. But also the parents doesn't like most of them, so they are attracted by the possibility to be treated with this kind of new technology that is extremely safe. And so we treat this patient 5 days a week for 6 months, thanks to the fact that it's easy to use this instrument. The device is wearable, and we gave a tutorial to the parents in order to usually the patients start the treatment in our visit for a few days or a week, and then when they became familiar, they start to use it, having 2 treatments a day. That was possible because of the collaboration and the design of this project. One alpha, that is more or less 10 hertz, and one gamma, 4 hertz, for 5 days, 4 or 5 days a week, most of the time 5, but sometimes also 4. You see both the technical details of LED and the intranasal LED. And we did the assessment with the childhood autism rating scales, that is the 14 domains assessed in behavior rating scales, with a range between 15 and 60, the Montefiore-Einstein rigidity scale that assess the difficulty of adaptation, behavioral rigidity, cognitive rigidity, and process domain. And also we have a home situation questionnaire that is it's a parent-rated measure of non-compliant behavior. So we involve the parents in the assessment. And I have to say, most of the cases, we also use other care person, like teachers or educators as blind assessor, in order to get really the sense of the effect of the treatment. And also we have the Autism Parenting Stress Index, that is a 13 items parent-rated measure that assess parenting stress in 3 categories: for social disability, difficult to manage behavior, and physical issue. So also we assess also the attention deficit scale for parents. Attention deficit you have seen in the presentation of a population that is a quite frequent comorbidity that only recently have been admitted to be assessed in autistic population. And I found this possibility of making an assessment of ADHD in this population very helpful when you have to treat them, because you can, most of the time, you cannot engage the child in any treatment before you start to work on his attentional span, because you need to have more attentional span to get the child involved. And then the peaceful sleep quality index, that also is a relevant part of everyday living parenting activity. So the main result was a reduction of autistic spectrum severity, as demonstrated by a decrease in the CARS score. You see that a nice progression from baseline to 3 months, and then progressively to 6 months. So it'd be interesting to keep assessment longer. We are now having kind of follow-up of this population. It's interesting to see that the improvement is not failed, but is keeping consistency as important. And also these are other measures, the MERS and the PSQE, people's quality of sleep. You see also the improvement in this other dimension, attention and sleep. As show, all the assessments show a nice progression and significant improvement, including the Autism Parenting Stress Index and the home situation question. So the life was a little better with the family, and sometimes little change can make a big effect in the living atmosphere in the family. Last study that I want to show you before I have a single case, it was run by our colleague, you see the name of Paolo Cassano, that is one of the leading figures in the field of photobiomodulation at Mass General Hospital. They have a clinical service of photobiomodulation that of course is off-label at the moment, but is a relevant opportunity to get a very safe treatment for a subject with a not treatable condition or not that had no adherence or compliance to other form of treatment. And this study was done in a group of adult spectrum patient. You see the wavelength A3 830, and these are the other characteristic of a pulsing rate and the treatment window, the dose, and they did the assessment of the autism spectrum symptom by clinician and self-reported arrays measures. And it's important because only after 8 weeks, a couple of months, they have a significant reduction of symptomatology in this adult population. This is important because, of course, we know that plasticity before the age of 12 is very, very active and start to be less active in adult phase. So it's important that an intervention that can work on the plasticity and inflammation can be effective also in adult population. And also you see there is no dropout, not in any of these studies. So the safety is something that's really impressive for considering the delicate population we are treating. And you see social communication, social awareness, social recognition, all part of the domain of social communication was improved with so that is really the core dimension of autism, the improvement of a social communication. So, of course, we don't know if in our study what was the most effective part of the protocol. That was not the purpose of our study. Our study was just exploratory in order to see the feasibility and the general response. So we use both protocol, gamma protocol and alpha protocol. Maybe, I mean, we is one option. Some we could have some predictor to address or to give the direction to the preferable treatment for each population, but at this point was not part of our design. And now I want to show you one case of a patient with a single case of gene SCN2A related autism in young adults. NCN2A mutant mice display several abnormalities, including that one in social interaction. And it's important that this gene codify a sodium channel, and usually you see also one of the first time very common is seizure, not in the subject we present, but have to be considered that modification, genetic modification of the sodium channel can lead not only to neurodevelopmental disorder, but also to seizure. That is very common in autism spectrum disorder. The subject was a 24-year-old male, IQ, high functioning, and diagnosed genetically, no history of seizure, but very impulsive and very difficult in interpersonal communication and verbal aggressivity. These are the design of a protein involving the genetic of this specific phenotype of autism spectrum. You see, it's important that one treatment for the seizure related to the same genetic of autism have been treated with vagus nerve stimulation. And it's important because it opened to the possibility, you know, that vagus nerve stimulation has been also used in refractory depression. And it's interesting because photobiomodulation could be an alternative or an option to be considered since you see the results. We have an improvement in the corner continuous performance test, that is a test mostly assessing the inattention, impulsivity, and vigilance. And in the sample, you see a nice improvement in all the dimensions of this condition. This is a MRI image of the subject where you find the hypofrontality, that is with the lack of parasingular circles. This was thanks to my friend Nikos Makris at Mass General Hospital. And it's important because, you know, so this is a specific form of autism with lead and related to hypofrontality and lack of parasingular circles, but nevertheless, it responds to the same treatment. So that we adopt the 40 gamma protocol from intranasal stimulator for 5 days a week. We use a gamma treatment in this case because we want to reduce the activity of the default network system. So in this case, we have a target. We want to reduce the distractibility and the irritability of the subject to shutting down the default network activity and to improve the attentional focusing activity in the subject. And you see how effective it was in terms of improving the executive functioning, assessed with Berkeley deficit score, and the stop signal task, where you see that how better was, how longer was the post-test. So the subject was much better in inhibiting itself and his reaction. So I take it home message is that photobiomodulation is a candidate treatment for co-future in autism spectrum disorder. We don't see, of course, there are only preliminary data. I'll show you the preclinical data, the study on children and adolescents of the other group and our own group, the study on adult, and the study on the single case with a genetic and definitive fingerprint of this condition. So efficacy in this specific form, genetically classified. And of course, it will be interesting seeing the effect on the autism in subject with SCN2A genetic to explore the potential efficacy in the treatment of seizure related to the same genetic. Because there is a very recent study that I found one of these days published this year, so last month, in animal models showing that photobiomodulation can treat seizure-like activity and neural survival in animal models. So if you consider that autism, 50% of the subjects with autism have also seizure, photobiomodulation that is effective in SCN2A related condition and in lab in seizure model of can be really something very interesting to be explored. Are there any EEG predictors or are specific protocol or light parameter to be specifically tailored for specific phenotype? This is still an open issue because, of course, we can have a general concept of the activity, thinking that photobiomodulation can reduce hypofrontality and therefore can improve the general functioning of cerebrovascular oxygenation of the frontal cortex. But also we have to figure that there is probably some molecular specific activity that we should identify and can be potentially lead to a customization of a treatment for specific form. And EEG can also one other instrument to be used, and we are using to find if you know, the low frequency or high frequency is more suitable for a specific subject. And also this is still an ongoing study, but we think that matching the EEG, QEEG characteristic with the choice of a protocol can be something to be to offer more precise definition, because you know in autism the problem has been so far that we don't have a clinical good characterization of this population. But if we can make a EEG definition of a phenotype, probably we are more close to offer a specific treatment to each subject. And this is our next aim, where we are headed so far, and we think that the friendly use of EEG and the safety of a photobiomodulation really offer to clinical research, like we are, a good opportunity to make a new study with a reasonable cost and also in a safe environment. So, of course, the next step is to identify specific subpopulation for specific model and protocol, and probably specific EEG characterization of a sample. And I think this is still ongoing, but I think that especially EEG, that is not much used in psychiatric field so far, have to be instead rediscovered, because we are now in the age where probably, especially in very young population, is probably a low-cost way to give a characterization of very large population and offer more specificity than other neuroimaging or neurofunctional studies. So we are looking forward to the next step, but we have some good, I think, good idea in the end. And thank you for giving me the opportunity to share our works today.
Well, insightful is the only thing I can really say for this. So, appreciate your years of dedication to culminate in this research finding. It would appear that from a clinical perspective, Stefano, that if you had you must feel something to have a patient who has, let's say, hypothesized ongoing inflammation in their brain, and the only treatment that they're given is talk therapy. Here, talk your brain to be less inflamed. Really appears like you're giving them a tool, to assist them in reducing the fire of their brain, which I think that if I'm correct, then that must be very satisfying for you.
Yes, we are. Especially now we are facing with a pandemic of these symptoms in children, especially post-COVID. We are now treating some form of acute onset of impulsive, compulsive behavior in children. And we know that we can count on photobiomodulation. There is already a study published from our Iranian colleague showing that photobiomodulation can reduce inflammatory cytokine peripheral and in the brain. So we think that is really something, especially I would say timely, because we are now facing with a long tail of post-COVID, and we are seeing a lot of this like increase of severity of a subject that were already been diagnosed for this disorder, but also we have new onset of obsessive compulsive and ADHD kind of disorder, of autistic behavior in the children. And I think that photobiomodulation can be really a good candidate, a good option, and we have already some good experience in treatment of this large population at this time.
Fabulous. Well, thank you so much, and continue your great work.
Thank you. Thank you.